So the next one we're going to talk about is called an S-lift, and I believe this is not a trademark name, but it was a very common name maybe 10, 15 years ago. I've heard it a lot, and this is a type of a mini facelift. So now we're moving into a surgical procedure, and this is a procedure that requires the incision. So obviously there are going to be some cuts and stitches involved. And the incision is in the form of an S and runs around the ear, of course, like most of the facelift incisions are. And it's a bit of a short incision, and this kind of procedure is typically designed for people of a younger demographics with early aging changes. So S-lift is equivalent of a mini facelift. It's a little different, but in general terms, it's very similar to a mini facelift, which is a lot more common name. So the next one is going to be a ponytail lift, and ponytail lift is a trademark name that is developed by a doctor in California. And the idea, and I was looking through his website, and the website is a bit vague on what exactly he's doing, but so I'm just going to relate my understanding of what this procedure entails. So hopefully this will help you as well. As I understand from his website, he tries to minimize the surgical part of the procedure by introducing endoscopic lift, right? So using the areas in a temple, for example, to hide the incisions, and using endoscope will help to lift the brows, which helps with the eyelid sagging. And to some extent, the jowls can also be improved with this type of techniques. Now, also the using some fillers is a possibility, and I believe this doctor is using the fat in the face, and also he's using a proprietary name for it or trademark name. So, but in general, from what I understand, he's using the fat to restore the volume and smooth out the wrinkles. Now, when looking at before and after pictures, I see the traditional facelift incisions, or at least I believe I see like a more traditional facelift incisions. So I'm not quite sure. There seems to be a bit of a discrepancy, at least in my view, between how the procedure is described on the website and what you actually see in the before and after gallery. But you know, if you go to this doctor for a consultation, hopefully he will be able to clear this confusion for you. But the idea, as I understand it from his description, is, I believe, is fairly well thought of. Minimizing the surgical part, minimizing the incisions, using the volume restoration, using the face tightening through smaller incision. I think all of those things are great. So it definitely would work for some people, not for everybody, not 100%. So some people need a bigger procedure, more skin removal, which would require a more traditional type of incisions. And some people can definitely have a quite significant facial rejuvenation through this very limited approach. So the next one is going to be a lifestyle lift. And a lifestyle lift is the company that's out of business now, and it's been out of business for a good number of years, but the name is still fairly popular, and people do a lot of searches on Google of lifestyle lift. And a lot of times they ask, well, what do you think it is? Was it good? Was it not good? And fortunately, I have a first-hand knowledge of what lifestyle lift is, because I at some point worked with this company. So I can tell you that this is a minimally invasive facelift that's done under local anesthesia with some mild sedation. Now, the technique of this procedure could be very different, and it entirely depends on a doctor. So some doctors may have done a skin-only lift, and some doctors may have done a sub-smas lift, and some doctors like myself, for example, would do a deep plane facelift when doing a lifestyle lift. So the technique of the procedure was really not regulated by the company, and the company said, you doctors, you are the ones who are ultimately responsible for the results. So you use any technique that you like, as long as you're using local anesthesia with a mild sedation, and you do this procedure at the lifestyle lift center, medical center, then it will be called a lifestyle lift. So if you'd like to get a lifestyle lift, that would be impossible because the company is out of business, so there's obviously no lifestyle lift centers. But if you thinking of a lifestyle lift, then you probably would be safe to ask your surgeon for a mini facelift, and it would be a fairly close alternative to a lifestyle lift. So again, this is Dr. Konstantin, and we were talking about the trademarked or proprietary facelifts such as Ponytail lift, Y lift, lifestyle lift, S lift. All those could be a good rejuvenating procedures, but most of them, like any procedure that designed with the specific patient in mind, it works for some people, not necessarily it will work for everybody. So make sure you take a good look at before and after pictures, do your research, do your consultation, ask all your questions, and then you would know whether any of those procedures would work for you.